Welcome, my dear students. Happy to see you here. I'm recording this at night, so my lighting may be a little weird tonight, but I hope it works. So, welcome to our class on assessment. And the syllabus is called Clinical Issues, but I think that's not quite clear because we will be talking about clinical issues in the next few classes. This is the moment in which, if you check the syllabus, we start talking about karma yoga. And the reason why we talk about karma yoga is because we're talking about the yoga of action. For the past few weeks, we've been talking in very conceptual terms. Basically, we have been talking about big concepts that sometimes are hard to land. But for the following few classes, we will be talking about very specific things and how to work with clients in these things. So these few classes are going to be particularly valuable if you are choosing as your paper option the one about the client, because we'll be talking about assessment, we'll be talking about specific conditions, and then we'll be talking about interventions in the next few classes. Today's assessment class anyway. So this idea of assessment and case conceptualization are somehow difficult to talk about in this field, and particularly in transpersonal psychotherapy. To make it simple, we're talking about three different concepts. First, assessment, which means what is happening with this client. Second, conceptualization, which is the answer to the question, why is this happening? And this has to do with your theoretical interpretation or position, as well as of what's going on with the client. And finally, treatment plan. And treatment plan is the answer to the question, how am I going to deal with this, or how can we deal with this? So these are the three concepts that we're going to be using here, mostly assessment. And if you read Sperry talks about why assessment is important, and we may or may not discuss this in class depending how relevant it is. But it's basically about the reasons why we do this is to help understand the client. And especially when we're talking about the spiritual assessment, we want to understand the client's perspective about spirituality. Are they religious? Are they spiritual? If they have a religious tradition, how is this tradition helping them? What is their world view? Can we use that spirituality or religiosity as a tool? Can we ask the client to use those resources for their benefit, or are those resources hindrance? Sometimes that some might not be useful for us to use. We will be talking in class about what is healthy and unhealthy spirituality. On the one hand, spirituality can be something that helps consolidate a fragile ego, but it can also be a hindrance. And some of you may be familiar with the recovery Christian or the wounded Christian, for example, to use one example. But also we could be talking about a Buddhist that is unable to think of anything that happens in their lives as important, because everything is passing, right? Everything is impermanent. And there are many examples, but anyway, is spirituality something that is helping the client to have a better, happier life? It's hard to evaluate, and we'll have a discussion about this in class. So I want you to ask yourself, what is healthy spirituality? And there are different perspectives. One that I really like, is by Jorge Ferrer, a teacher in the East-West program and a brilliant guy. He suggests that there are basically three levels that we can use to evaluate and spirituality. And of course, these are idiosyncratic, but I think they're useful to keep in mind. We have to evaluate the level of integration of the person in respect to their spirituality, how integrated the person is, or split for that matter. The level of embodiment, how much are they in their body, or are they disembodied? And finally, the continuum between selfishness and selflessness. So according to Ferrer, a healthy spirituality will help integrate the person, will be embodied, so which is in a way another way of integration, right? Embody, body, mind, spirit. And finally, it tends to help the person overcome narcissism or overcome selfishness. So think about it and think about how would you evaluate healthy spirituality. It's really, really an interesting question. One concept that we mention and we'll touch on class is this idea of what is my concept of God. The concept of God is an interesting concept that is clearly connected of having a healthy or an unhealthy spirituality. Is God a benevolent, loving being, or is God a judge, or is God a being? And I say God could be God, goddess, or whatever. It's impersonal. And what does that mean for a human being to live in a world that is impersonal? Sometimes we have moved beyond talking about God as a being, and we talk about God as the universe, right? Or the mystery. What does that do to, is there someone that cares about my suffering? This God, abstract God as the universe, is meaningful in the way that it brings me something. Does he, she, it cares about me? So our our concept of God is closely connected to our sense of what is meaningful and what has meaning and importance in life. So anyway, that's an important concept, and we'll talk more about how to assess for these things. When we talk about a transpersonal assessment, which is not exactly the same as a spiritual, we'll mention this in class. Johnson, in our readings for this week, makes an interesting point about getting lost, and he talks about many ways in which we can lost our way and how all of these are diagnostics. In a way, not only Johnson, but some have said that perhaps from a transpersonal perspective, all diagnoses could be summarized in one diagnosis that Johnson suggests would be something like loss of touch with self, loss of connection with spirit. Of course, that would be a very thin DSM of just one page, right? So we need to get more complicated than that. But when we're sitting with someone, how are they connected with something more meaningful, with something beyond that? That in itself is helpful for us to assess. Ingersoll, when he talks about using the integral approach, and he's coming from a Wilberian perspective, Aqual perspective. I hope you, in reading that particular article, you realize how much richer a picture of a client we can get when we get an integral approach, as opposed to just DSM diagnosis. And that's the idea. From a transpersonal perspective, we're not just going to think in terms of what is the symptoms, which is a DSM diagnosis, symptomatology only, but we're going to pay attention to behaviors, intellectual level, educational level, occupation, psychological, emotional, family of origin, cultural, spiritual dynamics, social and phenomenological aspects. So that gives us an opportunity to go way beyond what the DSM gives us in terms of diagnosis. Let's me be clear where we are uh, uh, trying to understand somebody's perspective, religious perspective, even if it is a tradition that you have studied, or perhaps even more, if it is your own tradition, don't believe that you understand him or her just because you understand the tradition. You have to always stop and really get beyond the general terms and understand how is this tradition reflected or manifest in this unique human being in front of us. And obviously, be aware of biases, your own wounding. We talked already about spiritual differentiation. This is a good place to keep that in mind. So we already talked about some assessment tools, right? If you remember, we use Aqual that I just mentioned again with Ingersoll, and we use Assagioli's egg, and we use Chowdhury's approach. So today I want to introduce you to another model. This model is you read about it, Ben Hanna's 5 aspects model. And let me see if I can bring that to the screen so you can take a look at it. So this is Ben Hanna's model. I won't go into the details because I think it's very, very simple, but I just want to name it as yet another way in which we can analyze all these five aspects. How is the client connected with his body, the embodiment aspect? How is is the client cultivating his or her mind? How is the client connected to the environment? Does the client has a community? Does he or she has friends, people to talk to, family? What is the client? How is the client connected to spirit? And how each of these aspects are in a way embedded, as Benhana suggests, by wisdom, creativity, and love. This means that all these three aspects, the body, how are we being wise with our body? How are we using our body in a creative way? How are we expressing love through our body? Same thing about mind, environment, and community and spirit, and how everything is held in by being. So again, it's a simple model. You can say that Benhana does not really do a lot of analyzing of the model. It's almost like a given, but it is a model that I use often, also with clients, just as Chowdhury and Aqual sometimes. But it's a model that I'm presenting you at yet another option that you can use to learn how to work with clients and to assess how the client is doing in all these perspectives. And again, just like Chowdhury's, Benhana's is an easy model to use, and you decide whether you want to use one of these approaches. My invitation is that when you assess and when you diagnose a client from a transpersonal perspective and from a humanistic perspective for that matter, don't limit yourself to the DSM. The DSM is useful as far as it goes, but it's very, very limited. And as you know, those of you that are already seeing clients, your clients are way more complicated than just a DSM diagnosis. So use these approaches. And remember, when you're sitting with a client, something that I hope you remember about the transpersonal perspective, nothing is ridiculous. Nothing is too bizarre. Nothing is unbelievable. Just engage and remember that our job is not to establish what is truth, whatever that means, but try to really understand whatever the client is presenting to us, how is it relevant in his or her story? Um, what does he say about the way they're behaving in the world? So don't dismiss it just because it's alien to you, especially when it comes to spirituality, right? Um, Again, something that I said before, and you know already, even the DSM includes this. Remember that uh, sometimes, oftentimes, culturally, what we believe that some cultures, the Western culture, may consider pathological, may or may not be pathological in other cultures. So again, that's why a cultural assessment, idiosyncratic and a phenomenological assessment is important, and a spiritual assessment is important to better get into the client's worldview. In a way, even though it may sound like a lot, and I remember I was talking with a weekend program student recently. I said, well, in my site, we are not allowed to bring religion into because I'm in a school. It's totally fine. But this is not about bringing in something. It's about assessing what the client is bringing to the session. So the client may not have a spiritual perspective. Remember, invited or uninvited, spirit is always present. If the client has no spiritual upbringing or spiritual approach or doesn't think of in those terms, that's fine. But most clients have an understanding of the cosmos, and many times it's a religious understanding of the cosmos. And as such, it's a resource. Again, can you use it? Can it help you to understand the client? And it can be a resource. I remember having a client with PTSD, and our first and foremost intervention for a long time was prayer. The client would pray to the Holy Spirit and would pray to Mother Teresa to help her deal with this trauma. So as spiritual understanding, it's a very valuable tool. And just as hopefully by now, if you had a client, you wouldn't have a problem asking them about their sexuality. In the same manner, be committed to explore the whole client experience and to support him or her in their conscious decisions that make them happy. And of course, if there's something to question, if something is not working, remember the question, how is this working for you? If something in their spiritual life is not working, is making them unhappy, guilty, shame, whatever, is worth exploring. It's not our job to change that. But if it is an important part of the client, or if it may be the reason why the client is suffering, it is important that we are willing to address it and to explore it. Finally, let me give you another one that is mentioned in the readings, and yet another form of assessment would be Saint Bonaventure Three Eyes. That is, I don't remember in which of the readings is mentioned. Seeing clients from the eye of flesh, the eye of the mind, and the eye of spirit. This is yet another way of seeing clients, right? We can either see it from the eye of the flesh, which is what is objective, what can be measurable, what can be observed from age, medical condition, symptomatology, etc. Then the eye of mind, this is something that you cannot observe. You have to relate with the client. You have to understand how the client makes meaning of life. Whatever the client is going through, how does the client and her community make sense of it? Is, for example, in Mexico, for example, in many communities and even in the US, divorce is something very shameful, something to be avoided. So if a client is going through divorce, we have to understand that in their culture or in their religion, that can be shameful. So we have to see it from that perspective. And that's something that we're not going to be able to see it by observing. We need to address by communicating with the client. Belief, personal history, culture, world vision, etc. All of that is seen with the eye of the flesh. With the eye of the mind. And finally, we have the eye of spirit. And this is the tricky one, because even Ingersoll, when he talks about it in the reading, he said, well, this is beyond words, right? This is the eye of contemplation. For this, on the one hand, you can talk about ultimate meaning, but it's more about being there and understanding and observing and being humble about how spirituality is unfolding in a way. Meaningful coincidences, what is the client's relationship with life. We could use non-ordinary state of consciousness like meditation. Obviously, we talk about different ways of dealing with non-ordinary state of consciousness. The Course in Miracles talks about the holy encounter. So the eye of spirit is the place when you see the client as another spiritual being or another manifestation of spirit, and you meet in that place. Again, it requires a lot of personal work, as with always, but it's something worth to keep in mind. In class, we will talk about other ways of assessment. I'll give you some example. But just to finish this lecture, let me give you yet more ideas of what you can do to assess a client from a transpersonal or spiritual perspective. You can use astrology. You can use the Enneagram. You can use the Tree of Life. Remember in our first or second class, I don't remember, when we draw the whole Tree of Life. That is a transpersonal experience. You can use the chakras. You can use the Eightfold Path. You can see how the client is doing in relationship to perfect speech, perfect action, and so on and so forth. So there are many ways that include different ways of knowing beyond the DSM. And that's precisely what we're going to be exploring in this class. So again, thank you very much for watching this video, and I'll see you soon. Bye-bye.